when Chinese doctors seeing patients, they will ask the first questions about date of birth. They start to actually draw a picture of people born in different year, different day, different time. It's already set up. It's like a system already there. So they affect their life, their health in general.
Dr. Da Peng Zhang. He is a Chinese medicine and acupuncture specialist with 25 years of experience. He has helped thousands of patients overcome their problems. Now he will show us how to unlock the secrets of traditional Chinese medicine for ourselves.
What inspired you to devote your life to be a Chinese doctor?
When I was like a boy, my mother had been very sick with a certain disease. She couldn't really get a good treatment from a conventional medicine. Made me really think what's the alternative way could help those patients like my mom.
Thank you for sharing this. But how does the Chinese doctor treat the patient?
Chinese philosophy or Chinese medicine, they treat people more like an individual case.
There has only one longevity habit that you will recommend everybody to do. What was it?
Treating the mind.
Let's start
by
talking about what is traditional Chinese medicine.
In my, it's from the textbook.
Okay.
It's more described like refined, like Chinese medicine is ancient, holistic, complementary medication.
Okay.
Without using any chemicals to treat a human being with different physical and mental conditions. So that is how we read from textbook. So what I feel, Chinese medicine is from Eastern culture. It's part of Eastern culture.
Oh.
Yes.
In which way?
Yes. For example, we are talking about Chinese medicine had a long history. It's possibly recent research say it has been existing for 5,000 years. So in years ago, we are talking about Chinese medicine being centuries, but now it's more like a long history. So, but people still using them. If you look at that, we got more and more people are interested in acupuncture, in using Chinese medication, or practice Qigong, Tai Chi. But those root is from our Eastern culture, our Chinese culture. We base on the human, but more like corresponding the humans is the theory of Chinese, of the human being connect with the natural energy.
So why do you think the Chinese medicine is important for today's lifestyle?
In my opinion, we have a complete two different kind of medication.
Yeah.
One is we call the conventional medicine.
Yes.
Another that's all people going to see the doctors, get the medication to treat different conditions, also having surgeries to treat different disease. But Chinese medicine more about two kinds. One is for prevention. So prevention means people using a natural treatment to prevent some problem, some disease happen in the future. So another thing, Chinese medicine, while using the medicine, can help people to change their lifestyle, dietary, even from the mindfulness to giving a different version to trying to balance. So balancing is very, very important part of your life. Because of all having like such as a big place like London, like New York, so people working very busy schedule. So we all need to get a proper balance.
Yes.
So getting our mind, our soul, our spirit, body to reach to the point to get complete balance. So Chinese medicine, we all based on the theory of balance. Balance the energy, balancing the body, to getting your body to corresponding with the natural energy. So all about that. So that's why we need the Chinese medicine as another, we call it complementary medicine. But then a lot of people using like alternative medicine, but I think Chinese medicine we should call complementary medicine.
And in Chinese medicine method, how do you diagnose a client when they come with their issues? So what is the normal process be like?
Yeah, when people coming in, Chinese medicine doctor or practitioner, they like to using 4 different basic diagnosis tools. So looking. So basically we see people sitting there, we feel the energy. We look first of all, we look at their complexions. So the colors or the face features, so the body language. So which is actually giving a basic image to show the practitioner what's the people in the very health conditions or not. So then we look at the tongue because tongue diagnosis is very important part for the Chinese practitioners.
Why the tongue?
Okay, in my opinion, tongue is part of body. Body system. Yes. So tongue is part of fascia system. Later on, we're talking about the fascias. Yes.
Definitely.
So it's in the fascia system, we have our body is covering by skin and the fascias to create a large net. So which is actually contact with external and to the internal organs. So as tongue is part of fascia system, so we can actually to show which part of internal organs get problems. We can predict the problems will happen while developing very severe disease. So that's why it's quite important. We can see the shape of the tongue, the colors, or different patterns of the tongue, so we can finding all the information.
Wow.
Yeah. Another very, very important tool for the diagnosis for Chinese medicine practitioner is we checking the pulse.
A pulse?
Yes. So we actually checking the very big blood vessels for each side, because each side is connected with the internal 3 organs energy.
Oh. So you check the pulse to feel how the organ are doing?
The blood flowing inside the organs or external organs.
Okay.
Yes. So they're providing a different rhythm, a pace, so you can pick up strong, they're vibrating. So they show in different patterns you can finding, because internal organ, although we're talking about the whole system like a network, but we cannot expect we have the same flowing of energy or same flowing of blood circulation.
Okay.
So through the pulse diagnosis, we can finding which part you have efficient blood flowing in certain area, but you also can diagnose it or some area get a deficiency flowing. So that's how you will possibly the practitioner start thinking what we need to do to keep a balance, to actually to change, to make a change, enable to making more balance in the system.
Wow, that is a very different approach from the Western medicine.
Exactly.
And would you say the 5 elements of Chinese culture also have something to do with the diagnosis side or the Chinese medicine?
Chinese medicine, we have 3 basic theories. One we call the Qi.
Qi. What
Later
is
on,
qi?
we're talking about the Qi.
Okay.
So we got 3.
Yeah.
Qi, yin and yang, and 5 elements.
Oh.
That's 3 very important basic, we call foundation of Chinese medicine theory.
Yeah. Oh.
Qi, first we're talking about the Qi you asked.
Yes.
So Qi is vital energy.
Vital energy.
Yes. So which is actually is flowing from external and internal of the people's body.
Okay.
Yes. So we making a little bit more clearer.
Mm-hmm.
So when you sit there, why you feel the people are very close to you, or you feel people keep a distance? This is how we call energy connecting. Oh, in very, very simple phrase, we call the chi connections.
That's a very interesting thing, because I recall there has a time that I do a cave meditation, that I'm the only one in a very small space. And then the master, nobody is allowed to talk. There
Yeah.
has no light and there has no air coming in.
Yes.
So the master, after let's say 5 or 6 days,
Yeah.
he wouldn't talk. He would just come here to feel the room.
Yeah.
And then he will know which stage of your mental awareness you are. And when I come out of the cave, then I can talk. I ask him, how could you know like if I'm finding those awareness or not? He said there has a smell and there has kind of chi in the room.
Yes.
The people who are suffered from hatred or judgmental, or they are in the process of releasing a lot of angers,
Yeah.
the room will smell, there has a sour kind of smell in it.
Yes.
But the people have a clarity.
Yes.
There has a different air.
Yes.
Just like when we go to different people's home,
Yes.
it's not about the size of their home. You embraced in their aura.
Yes.
When you are there.
Yes.
Is that the
Yes.
kind of chi we're talking about?
Yes. When you, for example, when you see someone, you have eye contact. Also, when you talk, the chi start, the energy through the chi flowing start connected.
Wow.
So this is the everything. For example, later on we're talking about acupuncture.
Yes.
If you're interested, they're all about chi flowing.
Okay.
The adjustment of the chi flowing. So then, and the second one we're talking about the yin and the yang.
Yeah.
This is a lot of Western countries. We recently a lot of people trying to figure out what's the yin, what is the yang. So we call a male and female energy. Very simple. Male energy is more stand for invigoration, so high vibrations, so encouraging. So that's all about yang. Yin is more for internal. For example, like more like water flowing. Yes, it's supplying the energy and transforming the food, the nutrients to nourish the blood. So this is all about yin. And in the house layout, we can see side is facing the sunlight, forcing the movement of the sunlight. So this is about yang. Yin is more in the not in it's opposite. Yeah, it's not facing to the light from. So when people feel, oh, this is something very calm, but not much lighting. So we're all talking about the energy regarding for the daytime or the nighttime. So daytime more for yang, for activities. So yin more like relax and resting. So that's for nighttime, for people sleep, so they get energy tonified. So that's more basic, the concept of yin and yang. So we get back to the original question about 5 elements. So 5 elements we have metal, wood, water, fire. So that's a different 5 we call the elements running inside the body. So they are also connected with the organs. Yes. So we're talking about more like function of the organs. So metal connects with the lung, according to the philosophy. Why is that? Because Lung is we're considering it's more like on the top of the body.
Mm-hmm.
Yes, they also is connected with the modern like philosophy of immunity function.
Immunity.
Yes, it's like defending.
Okay.
So you have to build up a solid defending.
Yes.
So that's how to describe the nature of defending function. Yeah, the ancient of Chinese way of thinking, metal.
Metal.
Yes,
It's long.
more like a solid
Yeah.
and strong
Yes.
energy.
Yes.
Yes. So we're also talking about another four.
Yes.
So wood is connected with liver.
Liver.
Yes.
Wood.
So liver energy more like they are emotional energy. So people, for example, people feel, I feel very irritated. We feel a lot of anger inside the body. So we considering is connecting with the blockages or ailments build up inside the body connect with the liver function. Liver should be like a wood. Wood is need nourish, need water to tonify, to growing. But when you have a blockages, liver energy getting so dry out and blocked. So and people or lots of like women's, they have clots, they have painful periods.
Yes.
And some people they're having struggling for sleep or disturbed sleep or from the blockages of liver flowing.
So that's related to wood and
emotions.
Energy,
wood and emotions.
Yeah.
So we describe trying to use something like natural. Everything we putting is natural feeling from the natural parts. For example, like wood, we think like trees or something like that. People can, because in the Asian we have only people like to observe the scenery from the nature. So they describe, this is we're touching the trees, we feel the energies, we know they're having seasonal changing for the trees. So this is how I connecting with the organs for humans. So we're finding this. What is the describe the nature of the organs function? It's connected with the liver.
Oh, that's interesting.
Very. So another part we are talking about the fire. Fire is connected with the heart.
The heart.
Yes. So people, for example, the heart is connected with people thinking and making a decision. And keeping them more active. So it's more like thoughts, more like ideas, more like this sort of like a concept they create.
Like courageous?
Yes. So it's glowing. It's non-stop glowing. How do you describe that nature? So people think positive fire is that. Also, it's on top of the body. Top of the body is more like a young glowing energy. So they say, that's also the fire nature is not stable. So people have different ways of thinking. They're affecting their mental thought. So people start to really like say, this is non-stable. This is more like nature of fire.
Okay. What about the water elements?
Water elements is Chinese people thinking it's the strongest energy. Because it's the base. So water contains very inner strength energy, which is keep our energy flowing. This is very connecting with the kidneys.
Kidneys?
Yes. Because kidneys is, for Chinese philosophy, is basic answers from the genetic traits from the parents. So it's restoring from both sides of kidneys. There's one we missed, earth. Very important. Thank you for reminding me. So earth is energy connecting with spleen stomach. It's the energy of, we call the house of engine. Yes. So when we eat food, we also digest food. We produce the nutrients to nourish the body, how important it is.
Yeah.
That's how we call the engine producing or productions from the house. So this is for basic 5 elements, how they connecting with the different organs. But organs is not just the organs for Western medicine describe just the organs. We're almost talking about more like functions.
Okay. But how does the Chinese doctor treating the patient according to these 5 elements?
Balance. Let's go back to the points.
Balance.
Yes. So let's give you an example. We have a different energy each year. So people born with a different year, different date, different time. This is their life codes for any people when they born. And then they're already giving the life code.
That's interesting because before we have interviewed Li Hood, he said we all have a DNA code. Yeah. And then according to the day and the time we're born, we also have 5 elements or personality code. Yes. I feel one thing I love about Chinese medicine is treating each individual as an individual person, not just like here is the answer for everybody's problem. So please do develop what those personality code to do with our health and our treatment.
Yeah. When Chinese doctors seeing patients, first they will ask the first questions about date of birth.
Yes.
They start to actually draw a picture to see the constitution of individual case. Because each year we put in all the 5 elements connecting with the body energy. People born in different year, different day, different time. It's already set up. It's like a system already there. So giving very clear indication of their constitutions. Either they connect with their parents, also they affect their life, their health in general.
About this, because I know when every time you go to a Chinese doctor, they will ask for your date of birth and time of birth, location of birth. I gave a lot of thought when I was younger. I was like, that's such a bullshit. Like, how can you know my health just according to the day and the time I'm born? I think that's a little bit, ridiculous.
Weird.
And then when I started reading about philosophy and the different things, especially about collective consciousness, when Adler writing about when you are the first son, when you are the second son, when you are the last kid, what kind of personality trait you have. I start to see, okay, if you're born in a very warm seasons, or when you are first come to this world in a very cold seasons, it's very likely to influence how your brain is formed at a very early stage of your life. So I think this is actually a very interesting approach to see a person in his lifespan, what kind of seasons or elements they are kind of first landing this earth into. And then according to the season of the real time, you give them a complementary treatment. So I start to, enjoy this. And since we've been practicing over past, 1 or 2 years.
1 or 2 years, yes.
I realized Chinese medicine is very, very steady. It's not like a fast cure for one day. But I see my body get stronger every day. I can see a huge shift from this year to last year. And I feel many other really fast treatment I have come across, they give a very fast effect over, let's say, 1 week, but then those effects fade away and sometimes they do harm for my body. So that's why, today's topic, I believe, is very important for our audience to go for a more stable, maybe slower, but overall faster way.
Besides that benefit, because when you see the Chinese practitioners, they're trying to draw a picture to make you understand what's body condition, how to keep your lifestyle healthier, and how to change your dietary to just like corresponding with your body constitutions.
Yes.
Yes. Also, they actually to tell each year what sort of like a health issue may happen.
Yeah.
We can take action to prevent that happen. So this is very interesting or part of Chinese medicine. A lot of people say, okay, I'll see Chinese doctor for asthma acupuncture for well-being. Not just like that. So for the long-term benefit, as you said, you see your body getting stronger, getting more balanced.
Yeah.
Even through your body balance, it's balance your mind, balance your spiritual energy.
Yes.
Also for the long benefits for longevity. So you know your body condition is. You know each year you consult with good Chinese doctors. That you know how you like your body to get stronger, get more balanced.
Yeah.
Are we from the complementary doctor's opinion?
So about the cold plunge, what kind of body type is good for the cold plunge? What type are not?
When people, for example, those people, if they're having very strong like blood circulation, the qi is strong.
Yeah.
But then they allow to have, but only very, very short time to having that. Because in general, for the general health, people, especially for our like senior citizen for the moment, we don't suggest them to having this sort of cold plunge.
Yeah.
Yes.
Yeah.
Because the thing is, we call the killing the actually the yang energy, or consume the yang energy. Because when you suddenly jumping to the cold water or using the icy water, basically is killing the strong protections or defending your energies.
Yeah.
Of course, it's cutting at some points stimulate, because we're always talking about two sides, the energy affecting the body.
Yeah.
So when you're having the cold, of course, sometimes it's invigorating other parts of the energy. But when you're getting extreme cold or icy water, it's more extreme energy, or we call excessive cold, which is killing the normal energies from the yang side.
Okay.
Yang side is the essence of life. If you always overconsume that yang energy, which is actually not good for your longevity.
Okay. And when we come here after we do the diagnosis, then what will be the treatment look like?
We possibly considering to giving people free different kind of suggestions after the diagnosis. First of all, we normally suggest a majority of patients to take acupuncture as a major treatment.
What is acupuncture?
Acupuncture in the textbook is we're using the phrase from the textbook is the Chinese medicine practitioner insert the needles in the body. And to try to invigorate the energy flowing or encouraging the energy flowing. So that's from the textbook. So acupuncture is more for, of course, we use needles, but in somehow we don't use needles. The practitioner we call non-needling technique. So we use just like fingers, or even sometimes we use a toothpick. To touching the body and trying to actually to shift the energy. So what about acupuncture is this two kind of like treatment, like needling or non-needling treatment to touching or contact with the body to actually to enable to shift and adjust the energy, to loosen certain parts of the energy, to making the more internal as a result to get a balance. So I believe that the acupuncture will start from a very long history and the ancestors, they like to observe the celestial bodies
Yeah.
in the sky, how they just trying to drop a map
Mm-hmm.
and corresponding with our human beings body.
Yeah.
So this is we call energy meridians.
Oh, energy meridians.
Yes, we got 14 main meridians,
Mm-hmm.
which is we call, and that's the basic is energy flowing channels.
Mm-hmm.
So this is the basic theory of acupuncture.
And the
So when
pressure's point was
Yes.
working on which layer of your body?
It depends on the diagnosis.
Okay.
This is where we go back to the points. When we do the diagnosis, we finding which organ or which cell energy is overflowing,
Mm-hmm.
which energy is deficiency.
Yeah.
Then we trying to make a plan, trying to select which meridian we need to get balanced.
Okay.
Then we try to also palpate a certain part
Mm-hmm.
to feel where the people getting blocked.
Yeah.
My opinion, we cannot really touching the internal organs,
Mm.
but we have certain ways through we touching the forelimbs
Mm-hmm.
and the terminal of the fascias, for example, like toes, fingers,
Yes.
legs, hair, even the elbows, the nose, the feature of the skins, enable to change, to shift the energy.
Yeah. Wow. And can you tell us,
Yes.
is for the people who haven't experienced it, is acupuncture painful or is doable?
Majority of people, they can actually to have the acupuncture without sort of like strong pain sensations.
Mm-hmm.
I wouldn't say possibly like less than 10% they feel pain
Okay.
because they sensitive or oversensitive for certain like stimulations.
And I know you do craniosacral
Yes.
practice and
Yes.
therapy as well.
Yes.
Can you explain to us what it is?
Cranial spinal system is very, very new theory.
Mm-hmm.
So basically what we're trying to do is we're trying to giving the system through spinal adjustment, but very minor one, and not strong, very soft touching to adjust the spinal. Basically to actually changing the way of deliver the message connect with the central nerves, all through the spinal adjustment, which is connecting with emotions. What most like 90% people, whenever you pressure either pressurinate or stimulate using the needles, people start feel release. And some people even develop. Last week, I treated 3 of my lady patients. When they try to unblock that part and release the pressure from there, they start crying badly.
Oh.
So this is showing different spinal connecting through the nerves, connecting with either your different nerve system or the organs.
Okay. Wow. So what type of patient normally come to see you?
We have a different various conditions of people coming to see the truth. Majority of patients coming with their chronic pain or chronic disease. Yeah, and some people they may see different consultants. They couldn't really figure out what the problem is. Very unexplained syndromes.
Yeah.
That's we treat. Or some people developing, for example, autoimmune system disease, or they're having the medication for a long time, but they wouldn't really achieve the good results from the conventional medicine.
Yeah.
We're also having a lot of people with conceiving problems, fertility issues, and imbalance with the thyroid, causing like chronic fatigue, energy problems, and anxiety, mental health.
Can you tell us how is your patient feel before and after the complete session with you? Maybe it's a course of few months or
Most of my patients should, through the first initial treatment, they start to notice the difference, more or less. Yes. So after my acupuncture or my fascia manipulation, later on we discuss that, people feel glowing, more space.
Yeah.
Some people say, oh, I'm taller. It's not taller.
Yeah.
It's increased space.
Yes.
Lets you get more space to flow in your energy.
Yeah. I recall one thing you tell me, one fundamentals about your practice is get the body back to what it originally are. You are not healing anything or cure anything. You just help me to set my body back to original how it's supposed to be, because our body don't come with the disease. Those are something attached. And another very interesting point is because I have a little bit unbalanced left and the right hand side, and you said you gave some room to decide. Can you explain that?
And
what it is
this
about?
Is another part why of my treatment. We're using lots of we call fascia series. Body, my opinion, is covered by a skin and the fascias, which is connecting with different systems. It's like a net, a large net with various size of compartments of these sort of blood vessels, muscles, bones, organs. They are so connected, but with a different size compartments. Yes. So what we're trying to do is we're giving very gentle touching. And we observe the body shape, and we touching, we palpate, we feel where the fascia system get blocked, which is actually affect the internal blood flowing or circulations. That's create problems. So we analyze the tensions, because the tensions is actually showing where the people getting problems, how we need making to re-recognize the past, how to return the original root. So first important part is we need enlarge the space. So when you have create a space, so the body can really finding the right path to going back. So it's more like people getting the way to go back home. Yes. So when you create a lot of tension, for example, people get scoliosis, the organs, because they are all part of the fascia system, they're softer. So they following the body shape. They twisted, they're getting so over manipulated. There are too much tensions, too much pressures in different parts, which is develop a different disease, different ailments in the future. So people come to me, we do a gentle, either using needle or non-needle work, to create a space, to finding the path, to let the body to go back to normal routine, and then to generally relax and release all the tensions. We're trying to actually not from the other therapies trying to giving a lot of force and strong manipulation. We're getting like following and let them to recognize what they should be. I like most of my patients to experience the mind connect with their body. Because every day we're living in this world, we have massive information, news, and massive work, family things. It's too much energy going on, overdrive our mind. we separate our body and the mind.
Yes.
But the very important part is you need your body, your mind, your energy with a spiritual from external, internal be connected.
Yeah.
This is how you make yourself more like holistic.
Yeah.
Rather than we separated them. When you're getting one side overdrive, the others are getting so sluggish, so slow down, you get problems because you lose the connection, you lose the balance.
Yeah.
So through the treatment, either touching, gentle touching, using a lot of my own technique, trying to bring up this result, people get reconnecting with the mind and the body. So, for example, we're touching the superficial fascia.
Yeah.
Superficial fascia is under the skin. There are two major nerve system is under the skin in between the superficial fascia.
Yeah.
It's motor nerves and the sensory nerves.
Yeah.
So sensory nerves is mainly to balance your mind, and the motor nerves is more for blood circulation. It's connection. So that's why when we work in different layers of fascias, which is adding a different pressure, trying to stimulate a different nerve system. So for long-term practice, I realize for lots of acupuncturists, even I've been teaching for a long time. So I saw the students just put the needles, boom, insert the body, and trying to soothe the sensation like strong stimulations. I feel patients won't get much difference from the treatment. Oh, some people do too gentle, more like placebo acupuncture.
Yeah.
So what the treatment is, we need people feel you touching a different part of their body.
Yeah.
So that's we call a different levels of the energy getting unblocked.
Yeah.
People should feel that.
Yes.
People should feel everything when the practitioner touching them.
Yeah.
So this is we call, because different layers, I believe they have different energies contains.
Yeah.
So when we touching, when we connect with the part, it's release some certain blockages or stagnations from the different parts, actually to encourage more blood flowing. When blood flowing, because in between the muscle layers, they're having, we call the fluid.
Yeah.
They actually do soothing the movement in between the layers. You will be able to move, to stretch, to do exercise, either do certain motions.
Yeah.
So when we encouraging more space, people feel relaxation.
Yeah. For those of us who haven't tried Chinese medicine or this method before, do you have any real life stories of your patient that you have treated you could share with us for people have understanding what Chinese medicine can do to them?
In the first, if you haven't tried any of the Chinese medicine, I think you should, before that, do some certain research.
Yes.
Then you gotta see what we need, what we really need to do, why I need to see the Chinese medicine doctor or complementary doctor from a Chinese background, what the benefit you need.
Yeah.
This is from our client's side. And from my side, I really think Chinese medicine is very beneficial for people. Even you have disease, or you just have a very minor symptoms, or you don't really recognize you have any symptoms, but you want to get a longevity prevention treatment, you should consider to see a Chinese doctor.
Yeah. And according to your practice, is there any everyday kind of longevity habits or health habits you can recommend us to do?
Meditation.
Okay.
That's also any suggest people, especially living in such like a big city like London,
Yeah.
you should find in like 10 minutes for yourself or 15 minutes for emptiness.
Yes.
Also, I suggest people trying, if you could, trying to find the instructor of Tai Chi
Yeah.
or a Qigong.
Yeah.
This is more practice your Qi
Chi.
and getting your natural energy flowing of the body. Like soothing your mind, soothing your body at the
Yeah.
same time.
Yeah.
Dietary is very important.
Okay.
Whatever, because you need to understand what your body condition is. Yes. So when you see its diet very, very affecting me, because people, lots of people, I feel 80% of people living in London don't have a good sleep pattern. Yes. Either from mentally, like stress, anxiety, or not from the diet. People eat late, drinking,
Okay.
and certain food, they are sometimes overcooked. Some of the ingredients they cooked, the flavor they add when they cooked, and they actually affecting your internal system.
Oh, but about dietary, for example, if I have a certain 5 elements point, and according to the season and the city I am in, will you give different recommendations
Exactly.
for seasonal food?
Yes, for sure. For example, like winter time, we encouraging most of people to having a little bit like warm nature ingredients, like cinnamon, ginger. So that sort of stuff, like warming energy,
Yeah.
warming the circulation, warming the stomach.
Yeah.
But people having inflammation, for example, sensitivity, we have also trying to encourage it to reduce like spice, because some of people, they couldn't really take too much spice, like chili, garlic. So when they eat that sort of like even curry, when they're having that, it's create more inflammation in their gut. So we also giving the dietary advice for those people when they come in to see me.
I would like to know if there has only one longevity habit that you will recommend everybody to do. What was it?
Trading the mind is the central of the concept of longevity from Chinese medicine.
Yeah.
Yes, yes, because peace of mind is the key of longevity in Chinese medicine. Whatever you do, is you need to find a way to get space to make you more central.
So, Dr. Zhang, what
Yes.
did inspire you to devote your life to be a Chinese doctor?
That's a long story. I think there are lots of impacts in my life, lots of stories. When I was like a boy, my mother had been very sick with a certain disease.
Yeah.
She couldn't really get a good treatment from a conventional medicine. So at the end, I was made me really think what's the alternative way could help those patients like my mom. I always want to be medical. I work always since I was a little child. I like to smells like the hospital or something like that. I really enjoyed it. Yeah, it's not joking. I really enjoy. I really respect what the doctor's job. I think they are more than just doctor. They are life healer for the patient. So when I was in the university, I was lucky because I got a chance to learn from a different masters of Chinese medicine. So 90% of them all pass away. But when I see them, even they're over 90s, they still seeing patients, do their best, trying to help people. It's encouraging. It's encouraging.
Wow.
Yeah.
Thank you for sharing this.
Yeah.
Thank you so much, Dr. Zhang for today's interview.